Welcome everyone to our research proposal presentation. We are Group 13 and the members are Greg Finkelberg, Jennifer Moreno, and Jisoo Che. Today we will discuss how public health interventions and socioeconomic factors influence the spread and severity of infectious disease. This research is crucial for understanding the effectiveness of policies in mitigating disease transmission. Throughout this presentation, we will explore relevant literature, our research methodology, and expected outcomes. Our findings aim to contribute to improved healthcare strategies. Research question. How do public health interventions and socioeconomic factors influence the spread and severity of various infectious disease, such as COVID-19? We aim to understand not only how effective public health measures like vaccination and sanitation levels, but also how socioeconomic conditions such as income level, access to healthcare, and population density affects disease outcomes. By addressing this question, we seek to provide a comprehensive analysis that can guide future public health strategies. Importance of the research. Infectious disease pose global public health challenges. The effectiveness of interventions, such as vaccination, sanitation, needs evaluation. Socioeconomic factors impact disease burden and healthcare access. Research findings will inform future public health policies and resource allocations. This research is critical because infectious disease like COVID-19 have disrupted societies worldwide. Various interventions have been implemented, but their effectiveness varies based on multiple factors, including economics and social conditions. Additionally, lower income population often experience higher infections and mortality rates due to reduced healthcare access and poor living conditions. Our study will help identify the most impactful strategies, allowing policymakers to design targeted intervention and address these disparities.
So how does the previous literature relate to the importance of our research? When looking at how socioeconomic factors impact disease burden and healthcare access, we decided to investigate both at the US or domestic level and at the global level for a comprehensive view. Amandi et al. Found that across the global landscape, lower socioeconomic groups were shown to experience an unequal burden when looking at the effects of disease. Among those factors include a geographic location close to the tropical areas, having less access to adequate sanitation, less access to healthcare or medical information, proximity to farm animals, less access to mass media, and greater nutritional deficiencies. Looking at the county level perspective, we reference Yin et al.'s 2023 paper on the spread of COVID-19 in the UK. Across socioeconomic factors. While this is not an international study comparing different countries' data, we thought it would be helpful to investigate the specific variables used in this study, including annual household income, unemployment rate, population density, ethnic and age distributions, annual mean concentration of fine particulate matter, coarse particulate matter, and nitrogen dioxide levels. In Ma et al.'s 2022 study at the US county level, this supported the claim further that lower socioeconomic factors adversely affected the spread and severity of COVID-19. Moreover, when looking at the effect of health interventions in the US, we reference Gardner et al.'s 2024 paper that showed that an increased population immunity via vaccines was associated with a lower risk for case hospitalization risk. Tied to socioeconomic factors again, Gardner et al. Also saw that an increase in Medicaid spending per person consistently showed a negative association with care hospitalization risk. In addition to vaccines, simple health interventions include hand washing. Patet et al. Studied a hand washing campaign to increase this simple yet effective technique in a hospital setting. After implementing the campaign, hand washing among patient-facing staff increased, and thus the hospital saw a decrease in transmissible diseases. A third public health intervention we investigated includes lockdown. Xi et al. Saw that this had a large effect on reducing the transmission of COVID-19. On the other hand, the reopening of bars increased the rate of transmission. Studies at the international level concerning public health interventions produced similar results at the domestic level. Moghada et al. Investigated the effects of vaccinations and produced similar results. Besnir et al. Looked at the effects of various health interventions in lower and middle income countries, and again saw similar results as well. What's interesting to note here is that Fang and Wang in 2023 proposed an estimated transmission model that would take into account the effectiveness of public health interventions and compared it to the actual rate of transmission seen in the UK during the pandemic. They did this in order to better understand the transmission of infectious diseases.
Hi, I'll be presenting our research methodology focusing on how public health interventions and socioeconomic factors influence disease outcomes. We will employ a multifaceted approach to gather and analyze data. First, we will conduct a systematic literature review comparing intervention strategies globally. Next, we will use quantitative data analysis by leveraging data sets from sources like Our World in Data, the WHO, and Johns Hopkins University to track vaccination rates, mortality rates, and other critical health indicators. We will also apply statistical modeling and visualizations using regression analysis and epidemiological models to assess intervention effectiveness. Finally, we will conduct comparative case studies, comparing public health policies at both the state and international levels to determine which interventions yield the best outcomes. To analyze our data effectively, we will use a combination of computational tools. Python and R allow us to process large data sets and perform statistical modeling efficiently. We'll also utilize Power BI for integrative data visualization, making it easier to identify trends and patterns. Additionally, we will refine our analysis techniques through DataCamp, ensuring we apply best practices in data science and statistical analysis. Through this study, we will aim to achieve several key outcomes. First, we will identify the most effective public health interventions by analyzing real-world data. We will also provide policy recommendations that optimize disease control strategies. Additionally, we will conduct a comparative analysis to understand how intervention efficacy varies across different socioeconomic backgrounds. Finally, we seek to strike a balance between public health measures and economic stability, ensuring that interventions are both effective and sustainable. In summary, our study integrates public health interventions and socioeconomic factors to provide a comprehensive understanding of disease mitigation strategies. By leveraging data-driven insights, we aim to inform future public health policies and support global preparedness for future infectious disease outbreaks. This research has the potential to guide decision makers in developing more effective evidence-based public health strategies. Finally, here are our references. Thank you for watching our video, and please let us know if you have any questions.